Hi, I'm Dr. Mallick. I'm working as an ENT specialist at Aster Medical Centre in Dubai. And I would like to talk about a particular condition that affects quite a few of us, but many of us take it very lightly. It's basically discharging ear, what is scientifically or medically rather called as chronic suppurative otitis media. So many a times we come across people who suffer from this problem, discharge from the ear, and many a times they're not aware of the problem. Actually, they feel it is something that has been happening since childhood, and every time it happens you go to a doctor, you take some medicines, and then it stops only to happen again. Most of the time this condition starts off in childhood. Children are very prone to developing this problem, and many a time it happens secondary to some infection of the upper respiratory tract, like an attack of tonsillitis or maybe sinusitis, rhinitis in children. The reason why it happens is because the nose and the throat is connected to the ear through a tube which is known as the eustachian tube, and this tube is shorter, wider and more straighter in children than in the adults, where it is longer, tortuous and slightly angulated. That is why adults don't suffer from frequent ear infections after getting an attack of cold as children do. And many a times, children may just complain of some ear block or pain in the ear after an attack of cold. These are the early signs of them developing a condition known as acute suppurative otitis media. So this condition can worsen, and later on there can be pus formation in the middle ear, and ultimately that pus will try to find a way out of the ear, and the easiest way for it to come out is after rupturing the tympanic membrane, or what is commonly known as the drum. And that is when these children start experiencing ear discharge. Their mothers bring them to the physician treats them, and the good part about this condition is if you treat them promptly, 90-95% of them respond well to the treatment. The ear stops discharging and the hole which is left behind in the drum closes. But sometimes this does not happen. The reason for that is mothers may not take enough care of the child when they have this problem, in the sense they may let water enter the ear, or they may not go to a pediatrician or an ENT surgeon for proper treatment, and the condition keeps on progressing, and the hole keeps becoming bigger and bigger and persists in adult life also. And that is how we have adults landing up with a discharging ear. So the thing about this is there is a hole in the drum. I will make it as basic as possible. There is a hole in the drum, and the middle ear is exposed to the environment outside, and most of these adults who have a hole in the drum, they will complain of some amount of hearing loss, and the problem that really troubles them is that they cannot go swimming. Once they go swimming, water enters the ear, goes into the middle ear through the hole, and the ear starts discharging again. At the same time, they may also say that whenever they get an attack of cold, the ear starts discharging. So these are the problems that keeps troubling an adult who's got a hole in the drum. That is hearing loss, and at the same time a discharging ear whenever he or she is suffering from a cold, or whenever water enters the ear, like maybe after a swim or something like that. So how do we go about a discharging ear with a hole in the drum? Many a times whenever these patients have problems, they go to their doctor. The doctor prescribes them some ear drops and antibiotics, and the condition resolves. But this is not a permanent cure, in the sense that this condition will keep happening again and again, and the problem it can cause is that the deafness can keep worsening. The infection from the ear can spread into the bones that are responsible for the hearing, damage the bones, and eventually over a period of time the hearing will become lesser and lesser, and not to say that he or she will not be able to go for a swim without using a ear plug or something like that. So how do we go about treating this problem permanently? The permanent solution for this problem is surgery. We need to close that hole. The surgery is known as a myringoplasty, or a simple repair of the eardrum. And how we do it is that we use something to close the hole which we call as a graft, and this graft is basically harvested from the muscle which is situated just on top of the ear, known as the temporalis muscle. and we go and seal the hole. Of course, it sounds very simple, but it's not as simple as it sounds, because we seal the hole and then there are so many other things before the surgery and after the surgery that needs to be taken care of, and eventually the drum closes, and post-operatively the patient says that he's hearing much better. At the same time, he can go about his swimming and taking a bath without taking precautions, and leads an unhealthy life after that. The question arises, why does one get a hole in the ear in the first place? As I said, during childhood, repeated infections, repeated upper respiratory tract infections, and these infections go through the tube into the ear, infect the ear all the time. But sometimes this may not be the case. Sometimes it could be a traumatic perforation. Many of the adults, in fact, not only adults, maybe children also, they play with the ear, they try to put instruments and earbuds inside the ear, and in that process they may traumatize the tympanic membrane, which may result in a hole in the tympanic membrane. Once again, a traumatic perforation heals very well, but then if that individual is prone to developing recurrent cold, or if that individual does not take precaution in the form of water entering the ear, once again infection can go into the middle ear and then result in a permanently discharging ear. By permanent, I say it doesn't discharge all the time. It discharges, you take treatment, it stops, only to discharge once again. So this is the message I'm trying to convey. I mean, if you have a ear that discharges, you need to consult your specialist as soon as possible and try to get a permanent cure for it, because one is, if you leave the condition like that, the hearing is going to go down over the years, and number two is 1% of the cases of otitis media, which I'm talking about right now, can result in a complicated type of otitis media, in the sense that the infection from the ear can spread to adjacent structures like the brain, some important nerves that are situated around the ear, and can result in complications. Okay, and nobody wants that to happen. So that is the message that I want to convey. If you have a discharging ear, please consult your specialist and get treated as soon as possible. Thank you.